Hello, hi, this is Dr. Sham. Hope you all are doing well. Another important topic today, that is the liver cirrhosis. So, what is actually this liver cirrhosis? So, what happens is that because of the chronic damage to the liver, the inflammation and disruption, either because of anything, for example, in alcohol, those who are consuming alcohol over a number of years, and those who are having chronic hepatitis, either B or C. So this chronic damage that leads to the fibrosis and scarring of the liver parenchyma, that is irreversible. And you do remember from your medical school, I believe, there is formation of the regenerative nodules. So what happens is that because of this chronic insult, so that damage and the inflammation, there's a disruption of the liver parenchyma, and it heals by the fibrosis and the scarring, which is irreversible and which is actually the liver cirrhosis. Let's talk about the basic things. If you remember, um, so these are hepatocytes, okay, here, and this is bile duct, so that's draining the bile, okay, and you have this hepatic artery and the portal vein. That's the blood supply. Most of the blood supply of the liver is from the portal vein, and less is from the hepatic artery. So it's a dual supply. So they drain in the sinusides, and sinusides drain into central vein, and that into the inferior vena cava. And these are the hepatocytes. So between the hepatocytes and the sinusoid, this is perisinusoidal space. So this sinusoidal space that contains a specialized cell, those are called stellate cells. These stellate cells, these are in perisinusoidal space. So these stellate cells, normally they are quiescent, they are dormant, they are not active. Their function is to store vitamin A. Okay, but what happens if there's a damage to the liver cells? Okay, so say for example there's a damage to this liver cell, so it's gonna secrete the factors which gonna change these stellate cells. So damage to the hepatocytes, they release some factors which change these stellate cells. What happens is that then these stellate cells, under the influence of the factors released by the hepatocytes as a result of the damage to the hepatocyte, the factors that are released that change these stellate cells, and this starts recruiting transforming growth factor beta. Okay, and they produce collagen that leads to the fibrosis and the scarring. So that's what's happening actually. Uh, and because of the stellate cells, the liver has got a regenerative capacity. You know that in a liver transplant, you can transplant a portion of the liver to the recipient, okay? And because of the regenerative capacity of the liver, okay, it can regrow. This is because of the stellate cell, but that's okay where you transplant the liver. But if in a normal person, these are quiescent, so as a result of the chronic damage to the liver cells, they can stop producing this transforming growth factor beta, and that's leading to fibrosis and the scarring, and that what happens in the cirrhosis. So that's what is explained over here. The stellate cell, they secrete a stored vitamin A, okay, and they're quiescent. And when there's a damage to the hepatocytes, these are hepatocytes, so they secrete the factors which alter these stellate cells. They start secreting transforming growth factor beta, okay, and that produces the collagen and the fibrosis. Okay, let's go back to the same structure here. Okay, this one, keep this one in your mind here, and we're gonna go to this structure. So this was your hepatic artery, your portal vein, your central vein. Sorry, that was your sinusoids. That's your central vein, and that leads to the inferior vena cava. That's how the blood supply is actually to the liver. So that fibrosis and scarring, and I mentioned the regenerative nodules. So these going to form over here. So I'm going to discuss about now what symptoms the liver cirrhosis produces in a patient. So these regenerative nodules, the scarring is formed, okay, and that's going to put a pressure on the sinusoid, and see that now this one is constricted. So it's a narrow channel now as compared to the original. So that's going to put a back pressure here. So if it's going to put a back pressure, what's going to happen? So the patient develops portal hypertension. Have you got it? How the patient develops the portal hypertension. So I've just explained a unit over here, but it's going on in all everywhere in the liver in a cirrhotic patient. So because this channel is narrowed, okay, let me change the color. So this channel is narrowed because of these regenerative nodules. They will be forming everywhere in the liver in a cirrhotic patient. So it's going to eventually develop a back pressure, and you end up in portal hypertension. And once you develop this back pressure, okay, so the fluid is going to leak into the free space in the peritoneum, and you develop the ascites as well. This back pressure, okay, you know that splenic vein. So this back pressure is going to go to there as well. So you develop a splenomegaly. So see that the symptoms, how this pathology explains the symptoms of the cirrhotic. That's what we call a stigmata of chronic liver disease. Moreover, what is going to happen? Hepatocytes, they are damaged, so they're less functioning. You know that the urea cycle, okay, that takes place in the liver. So if the cells are not functioning, you are not be able to clear the ammonia from your body, and that's going to go into the blood, and that leads to hepatic encephalopathy when it is above a certain level. Okay. Moreover, the liver is also involved in metabolism of the estrogen. So estrogen is not metabolized. So it's a more estrogen leads to pulmonary edema and spider angiomas. So see that one, how this pathology of the liver, this leads to all these symptoms. And as I have explained earlier, that what is happening inside the liver, that does explain all these symptoms. So portal hypertension, ascites, splenomegaly, less functioning, unable to clear urea, nitrogen. So it develops in the urea cycle is disrupted, and that leads ammonia, not the nitrogen. So ammonia, and that leads to the hepatic encephalopathy, and decreased metabolism of the estrogen leads to pulmonary edema and spider angiomas. Moreover, there are clotting factors that are produced in the liver, so there are less clotting factors. So there are the chances of bleeding in these patients. And then you have thrombocytopenia. That's very common in patients with the cirrhosis. So how it's happening? Actually, this thrombopoietin, it is produced in the liver. So damaged liver cells not producing enough thrombopoietin, leading to thrombocytopenia. Let's move towards the diagnosis. So the gold standard, very definitive, is the liver biopsy. But to be honest, it's not done as commonly nowadays. We have the other tests as well, like this FibroScan. So you can see the fibro as the name implies. So it's actually is a scoring system. Through this scan, it tells you your score, and based on that, like you tell the stiffness. This is scoring is actually the stiffness. So that's what actually you get to know that how advanced is the cirrhosis. Let's move towards the treatment. So it is irreversible, to be honest. Cirrhosis is irreversible, but you can prevent the ongoing cirrhosis, ongoing damage. What the damage is done, but you don't want it to be progressed further. So if the patient is taking alcohol, stop that one. What the damage is done, that's done. But if you keep on drinking the alcohol, so it's going to add more and more and more, leading from probably from a compensated cirrhosis to decompensated. So once it's decompensated, so the transplant is the only option. Okay, nothing is going to help. So the definitive treatment is the transplant.